I'm Dr. Sheri, your host for the show and the founder of the Live Today Foundation, a 501c3 nonprofit organization whose mission is to provide joy, inspiration, and free compression garments to cancer patients and survivors living with lymphedema. Now, those of you who may want to know a little bit more about the Live Today Foundation, guys, listen, I want you to go out to our website at www.live-today.org. Again, that is www.live-today.org. If you know someone, it may be you, it may be a loved one who are in need of compression garments, please send us an email at info@live-today.org. All you need to put is that I'm in need of compression garments in that subject line. Or you can give us a call at 754-220-0234. Those of you that are on social media, please follow us, engage with us on social media. We're on Facebook, Instagram, and Twitter at livetoday.org. That's livetoday.org. And listen, look for us on YouTube. Just search for the Live Today Foundation. You can grab a hold of all of the past episodes and remember to subscribe to our channel so that you can be notified when new episodes become available. Now, I am so excited about our guest today. I am so super excited because I finally have a wonderful guest who is going to help me continue this conversation specifically on how cancer patients and survivors can prevent lymphedema as a chronic debilitating disease. My guest, oh my God, Sabrina Korentager this woman is highly educated. She earned an undergraduate degree from Kansas State University in industrial psychology. And then she went on to receive a master's in nursing, a master's of science in nursing. She has over 25 years of clinical nursing experience that includes cardiac and cancer research. But listen, it was during her cancer research that led her to her true passion, and that's working directly with cancer patients who have been impacted with cancer-related lymphedema. And so she returned to school. That's how dedicated she is. She returned to school in order to become certified as a lymphedema therapist. And she has focused her attention on lymphedema prevention. Sabrina, welcome to the show.
Thank you. And I just have to say, I'm really honored to be here. I know when we first met, I was so excited to meet somebody who had a passion like I did. This is a pretty small world of people who are passionate about lymphedema. And so when you meet someone else that has the same kind of passion and thoughts and insights, you get really excited to be able to partner with them. So I'm honored to be here today and just really excited so that we can have more discussions and conversations with lots of people about this topic.
There we go. Oh my God. Thank you again. And I couldn't be more thrilled to pick your brain, right? And share your knowledge with our audience. So let's just jump right in. So listen, I know firsthand how fighting a breast cancer diagnosis or any form of cancer, how grueling it can be on the mind and body of patients, survivors, and even those who are newly diagnosed. Part of that grueling experience is this knowledge of possible side effects and complications of our cancer treatments. And lymphedema is one of those very real possibilities of side effects, devastating side effects of breast cancer treatment that can mean another battle to fight. From your experience, what is the percentage of breast cancer patients that are affected by lymphedema?
We estimate about 20% of breast cancer patients are affected, which is, obviously a much higher number than we would like.
Absolutely. And what can happen if it's left untreated?
Well, left untreated, there's really a couple of things. The first is obviously the physical condition. We know that people that have untreated lymphedema, oftentimes it progresses to a point where they're not able to enjoy their usual daily activities of living. And that could be anything from gardening to just routine social activities, all the way up to being unable to do their jobs. We had a patient that was an accountant, and her lymphedema had continued to progress so much that not only was she having chronic infections and being hospitalized, but she physically couldn't do her job. Now, this was a single mom who she was the sole supporter for her family. And imagine how both financially and emotionally devastating that is to have this chronic condition that then leaves you unable to do your job and care for your family. The other issue that we see a lot in chronic lymphedema is also the notion of the emotional aspect. And we don't talk a lot in healthcare about the emotional aspect that chronic lymphedema can have. We have patients who they're constantly reminded of having had their cancer, or they're out in public and people ask, why do you wear a sleeve? Or why is your arm swollen? And all of that is a reminder that they've had cancer. And then not being able, as I mentioned, to participate in your usual activities, gardening, caring for your children, all of that leads to an emotional component that can be actually really devastating for these patients.
Oh my goodness. And I can tell you everything that you just listed, I went through.
Yeah.
Lost my clinical practice career,
Right.
went through all of the emotional turmoil and thoughts of
Right.
donning my garment every day.
Yeah.
You want this to be past you and behind you, but yet you're constantly reminded.
Such a reminder.
Right. You know, advanced lymphedema requires this lifelong management with treatments and products and therapies that are costly and consuming. Can you describe some of these treatments and products and therapies that patients may have to endure with this disease?
Absolutely. You know, some of these patients, and I like how you said that they're enduring them, because what I want people to know is sometimes these treatments, which range all the way from, you know, the simple compression garments that you see, to bandaging, to wrapping, to wearing garments overnight, to daily massage. Some will be enlisted into, you know, really exercise types of programs that are designed to stimulate lymphatics. Some have to go to outpatient physical therapy several times a week. All of these therapies are usually just simply to manage. They're not making it go away, and they're not getting rid of it. They're simply managing it. And a lot of them aren't covered by insurance, and they're very costly. So now you have somebody that not only has survived cancer, but now they have this side effect that is impacting their daily life. Some of these regimens can take up to an hour or more every single day. And to the average person, that might not seem like a lot, but imagine every single day doing something for an hour or more only to maintain the condition. It's not even getting rid of the condition, it's just maintaining it. So at minimum, these individuals are wearing daily compression garments, usually a nighttime garment. They're usually doing self-massage. And then when it begins to flare up, they're going back to outpatient therapy several times a week, where they may be bandaged completely 24 hours a day. All of these things are very common in chronic lymphedema patients.
And you know what's so, for me, what is so devastating is that you can 10 years, 12 years out be considered cured from your cancer, right, but yet battling this fight for the rest of your life.
You're never cured.
Never cured.
Never.
But now that we've covered what living with chronic lymphedema could look like and does look like for many of us, I want to shift the conversation to a new and exciting viewpoint of detection and prevention. Oh my gosh, how I wish this detection and prevention had been available to me when I was diagnosed with cancer. But using simple and accurate monitoring, a patient's clinician can detect lymphedema early and intervene effectively, correct?
Yes. And this is where I could talk all day about this. I get so excited. There's something called an LDEX, which is available on Sozo. It's shown to be really effective, easy, accurate, and reliable in detecting early lymphedema. In fact, there's a couple of large-scale studies. One was a recent multi-center clinic trial that showed that when you use the LDEX in a surveillance model, it reduced this chronic progression to lymphedema by 95%. We know that using it actually works. Our own research that was published from my hospital showed that in the highest of risk patients, those patients undergoing full axillary dissections coupled with radiation therapy and chemotherapy actually only had a 5.6% of lymphedema. And of that 5.6%, one thing that I really like to highlight is that many of them were these very small stages, meaning they required very little maintenance during the day. So we know that this precise, early, and reliable type of monitoring can really identify who's at risk and how can we intervene. In our same study, we had a kind of what I call a hiccup rate, but we had basically 36% of our patients that triggered an at-home intervention. Of that 36%, only that 5.6% went on to developing that lymphedema. And again, that rate of lymphedema and the actual degree of the lymphedema was much smaller than what we traditionally think of lymphedema. These are patients who aren't the very large swollen, they're very low level that is maintained. And to the average person, you wouldn't even know they've developed lymphedema. So not only is it safe, effective, and reliable, a lot of times it can reverse, cure, prevent, or certainly prevent it from progressing to a level that is what we're so commonly familiar with.
Wow. Okay. So you tested them and you stated that 36% of them triggered something. So somewhere in their testing, the score changed or what have you, it triggered. And then did you guys provide or recommend some form of treatment? And that's why only 5%?
Correct.
Okay.
So we did pretty simple treatments, and this is where this is the beauty of SOZO. We actually did where we used compression sleeves, which is a very standard treatment for the treatment of lymphedema. So when these 36% of these patients triggered a result on the LDEX SOZO platform, we had them do a 4-week regimen of using a compression sleeve. We also encouraged basic stretching, being healthy and active lifestyle, not running marathons, but, basically being up and moving. And then we did use, in some patients, we did say, self-massage can be a benefit. And we're talking a very modified couple of minutes. But the basic treatment intervention was the use of a compression sleeve. And of that 36%, only 5.6% developed what we call chronic, at least stage 1 lymphedema. And I can tell you that of the 5.6%, over half of those are only a stage 1.
Wow. Okay. Yeah. So in other words, it's extremely important to get tested. You can't trigger anything, and you certainly can't trigger a treatment that could prevent chronic lymphedema unless you get tested.
Correct. So it's actually key. The whole premise of this is it's key. Testing with LDEX only takes minutes, and really it can be part of your routine follow-up. It doesn't even require a lot of additional visits or anything else. But if it's part of your routine follow-up, then it enables this early detection, which then of course enables early intervention and treatment, which then can prevent developing lymphedema.
Okay, so once a patient gets a baseline LDEX score using this SOZO device, you're stating that regular monitoring is important for this early detection and treatment.
It's essential. So finding a provider or a surgeon or a therapist who offers this is really essential. The baseline is the first step. Once you have the baseline, it sets the stage for your routine follow-ups, because really SOZO is designed, LDEX SOZO is designed to catch it before symptoms have started, before you have swelling. And so that's why it needs to be part of your routine follow-up, is to really find it so that it's detected early, because then when detected early, treatment is simple, effective, and it most of the time can, as we've shown through research, and most of the time it resolves the issue.
Wow. Okay, so in summary, see, I love this, because even though I can't benefit from the new technology, what I can benefit is leaving a legacy for individuals who can. So I really want to get this straight so that everybody can understand and appreciate, because I've been on this soapbox, but to have someone with your knowledge and expertise coming and validating what I've been shouting to the rooftops. So in summary, a newly diagnosed cancer patient and or even a cancer survivor who may have not even noticed swelling yet should first ask their doctor, do they participate? Ask their healthcare team, do you participate in a lymphedema prevention program? And if not, please, everyone, go out to the Live Today website at www.live-today.org, and you can find your nearest provider. So you got to get tested, right? And then with the regular monitoring, their clinician can detect when early reversible changes of lymphedema have occurred. And this serves as a trigger. And at that point, they can intervene with simple at-home care and get treated. So the 3 T's to remember are test, trigger, treat. And with the proper intervention, chronic debilitating lymphedema can be prevented.
Correct. And I think one thing that's really important to note about prevention, early detection, a lot of these patients, for example, of the 36% of ours that required intervention, they don't require intervention lifelong. Many of them have gone back to just normal types of risk reduction things that we recommend in our clinics. So it's not that this 36% now wear compression sleeves all day, every day. Only this 5.6% have gone on to needing some type of daily treatment. So really, to drive the point home, with early detection, you can actually correct and reverse those early changes that are causing the possibility of developing chronic lymphedema. So many of our patients have gone on to having the same lifestyle that they had before they had cancer, which is really where the game changer is giving cancer patients back their ability to be normal again.
Sabrina, I wish I could pack you up every time I go to do a keynote and I have the opportunity to take the stage with cancer patients, survivors, people who have no connection with cancer as of yet that they know of, and they're just trying to be there and be a help. Wish I could carry you with me, pop you out.
I wish I could too, because I would love for the world to adopt this. I believe every person deserves this.
Absolutely, they do. Now, as a therapist, you're treating lymphedema patients on a regular basis. What parting words do you have for cancer patients and survivors?
I actually have two parting words. One is, I think as a community, especially myself, I recognized years ago we needed to do better. We needed to stop treating lymphedema as a side effect. We needed to stop saying, you're cured of your cancer and so you have the side effects, so what? That was the first thing that I want cancer patients to hear from me. As a therapist, I want to do better. I want every patient out there to have this technology available to them. And to patients, I want you to understand that early detection prevention is available. There's so many myths out there about lymphedema isn't preventable, it isn't treatable, you can't detect it. And I want people to understand that's just false. We, over the last almost decade now, have proven that you absolutely can detect changes that are indicative of developing lymphedema. And I think every patient has the right to ask this of their healthcare provider, saying, do you offer LDEX? Do you offer a lymphedema prevention program? Because no longer should lymphedema be thought of as just a side effect. It should be thought of something that is preventable, treatable, and can be reversed. And all of our cancer patients deserve to have this technology available to them.
See, that's powerful. That's powerful. I couldn't have said it any better myself. Listen, guys, those of you out here that want to know more on the Live Today Foundation, please, you want to know more about the Live Today Foundation, you want to get in touch with us because you know someone who is in need of compression garments. They're under-resourced, uninsured, underinsured. Or you want to find out where you can go to get tested, please go out to our website at www.live-today.org. Shoot us an email for those compression garments at info@live-today.org. Or you say, I'm not on email, I'm not one of them computer people, pick up the phone and give us a call at 754-220-0234. And again, please engage with us and follow us on Facebook, Instagram, and Twitter at livetoday.org. That's livetoday.org. Please go out to YouTube, search Live Today Foundation or the Live Today Foundation. You will be able to find this episode, as well as all past and future episodes, should you subscribe to our channel, and stay in touch with us and make sure you have all of these tools and assets at your disposal. Sabrina, thank you so much for your time today. I mean, you are not only a well-informed and knowledgeable therapist, but you are a wonderful and compassionate patient advocate.
Well, and thank you for what you're doing. Like I said, the more people that can hear the message and the more that you're getting this out there, it's changing the way we view this. And it's going to change for the better, the standard of care we provide to all of our patients. So you're doing an amazing job of helping get that promoted. And for that, it just excites me to be able to have partnered with you on this.
God bless you, Sabrina. Thank you, everyone, for tuning in today. I'm Dr. Sheri, and remember, be present, take charge of your life, and live today and every day.